sweat glands. Now, if you examine the skin, in the skin, you will find these hair follicles and you will find these sweat glands. Now, these sweat glands, they have two portions. One is known as duct portion and the lower secretory portion, which is also known as coil portion. So, duct portion conduct the sweat and coil portion secrete the sweat. Such type of glands are eccrine sweat glands. These are the common sweat glands present all over the body, but some sweat glands you will find that they open along with the hair follicle. They also have two portions. One is the duct portion, other one is the coil portion. But this duct is opening along with the hair follicle, while here the duct was directly opening over the skin. Such type of duct is known as, or such type of gland is known as apocrine sweat gland. So these are two different types of sweat glands. They can be apocrine or they can be ecrine. Now, what are the differences between these two? Ecrine and apocrine. The first difference is, if you examine the duct, you will find that the duct opens directly over the skin. Well, while in apocrine, they open along with hair follicles. Another difference is site. Ecrine sweat glands are present almost everywhere, while apocrine, they are mainly present over axilla. Though other sites are also involved like areola, groin. These ecrine sweat glands, if you see the nerve innervations, these ecrine sweat glands are under cholinergic control, while these apocrine are under adrenergic control. There are various disorders which are related to ecrine sweat glands and there are disorders which are related to apocrine sweat glands. Before discussing these disorders, have you noticed anything special here in this table? See, apocrine starts with alphabet A. So everything here starts with alphabet A. So it becomes so easy to remember. Apocrine duct opens along with hair follicle. It is mainly present over axilla and it is under adrenergic control. While in ecrine, C is repeated twice. So this is under cholinergic control. It starts with E. So it is present everywhere. And which alphabet comes in between C and E? D. So it directly opens over the skin. So you can see how easy it is to remember all these differences. Now the disorders are also very important, especially these two disorders. One is malaria and other one is Fox-Fordyce disease. So many times these questions have been asked. Malaria is disorder of ecrine, while Fox-Fordyce disease is disorder of apocrine sweat gland. Why these two appear? Both are due to a blockage in the duct. So both these are due to blockage in the duct of, if the blockage is in the duct of ecrine, malaria occurs. If the blockage is in the duct of apocrine, Fox-Fordyce disease occurs. So both are due to blockage in the duct of ecrine or apocrine sweat gland. Now there are other disorders as well. So the disorders which are related to ecrine are anhidrosis, hyperhidrosis, malaria, while the disorders of apocrine are bromhidrosis, chromhidrosis, Fox-Fordyce disease, hidradenitis suppurativa. See, N means absence and hydrosis means sweating. So, absence of sweating is known as anhidrosis. Hyper means excessive, hydrosis means sweating. So, excessive sweating is hyperhidrosis. Brom means foul smell, chrome means color. So, foul smelling sweating is bromhidrosis, colored sweating is chromhidrosis. Now, why does sweat have a smell? This is generally due to infection. Now, this infection can occur both apocrine as well as ecrine sweat glands, but generally it is in the apocrine sweat glands. Sometimes it can be due to infection of ecrine as well. So, if they ask you that bromhidrosis is a disorder of and both is there in the option, choose both. It can occur due to infection of apocrine as well as ecrine. But if both are given in separate option and both is not there, then choose apocrine. Now, why sweating have color? This color can be due to various investigations where we use various dyes. So, this is due to dye. It can be due to lipofuscins which are secreted in the sweat. So, it can be due to lipofuscins. Or it can be due to certain drugs, like you know that the drugs can cause colored sweating or color of the urine changes. So, like mapacrin is one drug which can cause chromhidrosis. I already told you malaria is due to blockage in the duct of ecrine sweat gland, while Fox-Fordyce disease is due to blockage in the duct of apocrine sweat gland. This Fox-Fordyce disease is very common in females, especially in their second decade. So, this condition commonly occur in females in their second decade. And because it is due to blockage in the duct of apocrine sweat gland, and apocrine sweat glands are commonly present over axilla, here also the most common site is axilla. And over axilla, these patients may present with small papules. So, if you get small bumps or papules over axilla of a female during the second decade, then you should suspect Fox-Fordyce disease. While hidradenitis suppurativa is also a disorder of apocrine sweat gland, so here also the most common site involved is axilla, though it can occur in groin as well. So, axilla is the most common site. And how these patients present? These patients initially presents with nodules or swellings in axilla. Gradually, there are multiple sinuses which are formed, which are interconnecting these nodules or swellings, and they heal with scarring. So, if you find these three things over axilla, that is swellings with interconnecting sinuses and scarring, then suspect hidradenitis suppurativa. Initially, when only nodules and swellings are present, then medical treatment helps. But in the later stages where scarring occurs or multiple sinuses are formed, then we give surgical treatment. So, surgical treatment is advised in later stages. But initial stages, you can give medical treatment, and the medical treatment can be in the form of, so in grade 1 where only nodules are present, you can give medical treatment like doxycycline, clindamycin, or there is one biological drugs like adalimumab. So, all these modalities can be used. This malaria is due to blockage in the duct of ecrine sweat gland. And depending on the level of blockage, you can further classify this malaria into three types. You can call it malaria crystallina. If the blockage is at the level of stratum corneum. Malaria rubra. If the blockage is at the level of Malpighian layer. And malaria profunda. if the blockage is at the level of dermoepidermal junction. Among these, the most common type is malaria rubra. So if the level of blockage in the eccrine sweat gland is very superficial at the level of stratum corneum, we call it malaria crystallina. If it is at the level of malpighian layer, we call it malaria rubra. And if it is deeper at the level of dermoepidermal junction, then we call it malaria profunda. Now, all of you might be wondering that we have discussed all the layers of skin, but we have not discussed malpighian layer. What is this layer? So remember, malpighian layer is another term which is used for lower epidermis. Lower epidermis, that is stratum spinosum along with stratum basale. These two layers together forms malpighian layer. So malpighian layer is nothing, it is lower epidermis, that is stratum spinosum along with the stratum basale. And this type of malaria is the most common type of malaria, malaria rubra. Do you know the common name of malaria? Malaria is nothing, it is prickly heat. Okay, so prickly heat is malaria. And it is due to blockage in the duct of eccrine sweat gland. So I hope all these disorders are clear to all of you. These are the disorders which occur due to involvement of sweat glands which are present in skin, which can be eccrine sweat gland or apocrine sweat gland. Especially these three are very important: malaria, Fox-Fordyce disease, hidatitis suppurativa, and also question have been asked on bromhidrosis, which can be due to involvement of both apo as well as eccrine.